All right. Well, good morning, everybody. Thanks for being here. Katie, thank you for sharing that. And it's very exciting for us at the Ending Pandemics Academy to see that the #1 gap and priority is pandemic preparedness. And we're really excited and hopeful that the efforts that we're going to focus on at the Academy are going to help bridge that and fill that gap. So today I'm going to talk to you about a project that has been very integral to the work at Ending Pandemics before we became the Ending Pandemics Academy, and something that we've brought to the university. A little story is when I just started at Ending Pandemics, this was the first project that was assigned to me in my portfolio of projects. And I used to call it my problem child in my portfolio of projects. But over the years, I mean, it was natural. It was early on in the stage of the project. It was growing pains. But over the years, it really, through grit, collaboration, and just this perseverance, we were able to really make this into the vision that we had for early verification. And it quickly turned from my problem child to my golden child. So happy to share more about this project with you. It's a pretty well-known fact that pathogens do not respect the boundaries of species, sectors, or even geographies. However, more often than not, our disease surveillance systems still do. With public health departments focused on the health of human cases, veterinarian departments focused on animal health outbreaks and diseases, and the environmental agencies focused on the ecosystem. And each of these activities, of course, are important and vital in their own right. However, this siloed approach can more often than not miss the bigger picture, especially when it comes to disease surveillance, as well as pandemic and outbreak prevention and preparedness. So in recent years, I think these keep going. Early warning systems have advanced and signal in their capability to scrape the internet for signals and early warning alerts. They can scrape the media, the internet, potential other ways of capturing these early detection capabilities. And this proliferation of digital disease systems has led to an immense increase of signals. And the issue is some of these signals are real and some of them are false. And we at Ending Pandemics, we realized there's this real need for us to help verify if these signals are real or not. And so in 2016, we built a system that was meant to be focused on helping with verifying if these signals are real or not. And we did this through a partnership with a few organizations that were really pushing the boundaries of disease detection. And the system we developed is called EpiCore, and we designed it in partnership with 3 organizations, and I'd like to spend a little bit of time to tell you a little bit about these specific organizations. So the first organization was ProMed, which stands for the Program for Monitoring Emerging Diseases, and they're focused on rapid dissemination of information of potential outbreaks across the globe. They operate 24 hours a day, 7 days a week, and they have subscribers in almost every country around the world. The second organization we partnered with is HealthMap. They were based at Harvard, and they were one of the first organizations to visualize these online signals about emerging diseases. And the third organization is TEFINET, which is a global network of 83 field epidemiology programs across the globe. So we got together, and with each of our capacities and capabilities, we decided to design and develop EpiCore. And once you understand how EpiCore works, you'll see how it can transform our abilities to verify outbreak signals faster and more efficiently. So EpiCore is more than just another digital platform. It's a global virtual community of health professionals who span the One Health network. We have human health experts, animal health experts, and environmental health experts that provide information on ground truths to verify if a potential outbreak signal is real or not in real time. This map that you see will showcases the distribution of our just under 4,000 members across the globe. When you look at the interface, we actually have the ability to see which of these members have which expertise, as the dots are color-coded on the user interface that we have. And currently, most of our members, as you'll see, are with human health expertise. However, our animal and environmental health expertise is currently growing. This is actually a really great opportunity for students to partner with the Ending Pandemics Academy. It's a great way for students to learn how to engage a network or members of a network, how to increase membership through recruitment, and also several data analytic opportunities when it comes to the information we have on Epicor. We're excited to engage students on this. So here's a short video that actually describes what Epicor is quite succinctly.
Unnecessary delays in the effective response to a genuine health threat are often the result of the time to verification. This is the time it takes to determine if a reported threat is real, so that an appropriate response can ensue. What if we could connect a global network of human, animal, and environmental health professionals to help verify early signs of potential health events? We can. This is Epicor. Epicor is a volunteer virtual community of One Health professionals crowdsourced to support rapid verification of potential health threats. Created in 2012 by Ending Pandemics as an initial partnership among TefiNet, ProMed, and HealthMap, and officially launched in 2016. Epicor volunteers have been quickly verifying early warning signals or refuting rumors of potential outbreaks, thereby preventing delays in rapidly responding to true health threats. This is how Epicor works. The verification process consists of confirming or refuting early signals about potential events through the contribution of cross-sectoral health professionals in the same geography where events are reported. All verified information on Epicor is shared openly online. Currently, requests to the network on average receive a response within 24 hours. Among its many utilities, Epicor has been used for verifying early detection signals, risk assessment, and monitoring ongoing health events. Epicor does not aim to replace any official verification system and is meant to be a complementary verification tool supporting health authorities, and is currently contributing information to WHO's EIOS platform. Epicor provides a novel mechanism to increase the speed of verification of early warning signals detected across the globe.
So what's powerful here is that Epicor operationalizes a One Health approach for outbreak signal verification. It bridges those sector and geographic silos by engaging health professionals across sectors as well as across geographies through this trusted global network. And so when a disease signal is detected, and whether it comes from a rumor or an unusual cluster of diseases or from social media or a local news report, Epicor requesters, and these are some of the organizations that use our platform, we call them requesters, they're able to send a request for information, an RFI, to our volunteer network of responders or members in the field. What's important to note is when one organization sends a request on our platform, all the organizations can see that information, and we designed that intentionally to break down these information silos, even between organizations who are in different sectors, but also just in different spaces and geographies. And so once that information is sent to our members or responders in a specific region where that alert is happening, they're able to respond quite expeditiously, is what we see, by providing context-rich information that helps verify whether an outbreak is real or not, or what might be driving it. Their responses help these actors distinguish false alarms from real threats, as well as provide information on risk assessment if a certain event is already known that it's happening. It helps confirm if an outbreak is real sooner than usual, and this accurate field data just helps with really updating ongoing events. And in fact, Epicor consistently sees a high proportion of these requests responded within 24 hours, and it's really a testament to how quickly this network can act. So as you saw in the video, the information, once it's collected, is summarized and put on our public dashboard. And this is important because anyone can access this public dashboard, regardless of what agency they sit in or which sector they sit in. And additionally, right now, the data from this dashboard is a direct feed into WHO's platform. It's called the EIOS platform, Epidemic Intelligence from Open Sources. And it directly feeds into it and is another trusted source of information. And I'd also like to say that Epicor is highlighted in various workforce trainings today, including field epidemiology trainings across the globe. So what I'd really like to do with you right now is showcase 2 case studies with you to really help you understand the utility of this network and the type of information that comes through this network. So the first case study I'll share was a case in 2024 in Nigeria, and there were 160 deaths reported of children actually from the local news. And so we decided on Epicor to send a request to our members in that region. So you see that box, those are the members that the information was, or the request was sent to, and you'll see the color coding with orange and red that I alluded to before. Those are human and animal health experts. And very quickly, soon after we sent that request, our first responder replied back noting that, yes, this is a true event. The exact location was shared by that person, and also their suspicion that this was likely due to illegal mining, providing context around this news report. The second person responded 10 minutes later, stating that they suspected poisoning. It was likely lead and chromium poisoning, and very importantly, that all infectious disease tests were coming negative at that point. And then later that evening, another member responded noting that the Nigeria CDC was monitoring this very closely. They shared an official online statement that was shared locally and shared more information with us about the symptoms, which in this case were fever, vomiting, and weight loss. And so we took that information, put it on our public dashboard, and it actually led to an alert on WHO's EIOS, and that's what the EIOS system looks like. And then the second study I would like to, or case I would like to share with you, of course, is COVID. You know, what happened on Epicor during COVID. And so, as you'll remember, December 31st, Hong Kong Ministry of Health put out the first alert. That was the first alert that came out online. And we decided on January 1st to put out an RFI, a request on our platform to ask our members in the region of Wuhan what was happening. We read from that report that there was severe acute respiratory illness clusters in Wuhan, China. And very quickly, our first responder wrote back noting that while the media and whatever information was available at that time noted that this was linked to a seafood market, they alerted us to let us know that this was actually more than a seafood market. This market actually sold live other animals, which is very important context as we didn't know what was happening at the time, recognizing the possibility of a zoonotic event. They also, of course, confirmed that this is true. There is a cluster of respiratory disease. On the next day, we got 3 very critical pieces of information. The first responder noted that people were actually being reprimanded for spreading misinformation locally about this event. So just helping us understand about the current situation on the ground. The second responder that day noted that, yes, this is, again, truly an event, and that the pathogen, or the exact pathogen, wasn't known. But later that day, we received another comment from another member noting that they actually were at that point suspecting a coronavirus crossing the species barrier. And this was on January 2nd. More information continued to trickle in over the days, and WHO put out its first public online statement on January 9th. And then on January 10th, we continued to receive information from our members noting a lot of alarm actually at that point, because they were recognizing that the Chinese New Year was approaching and there would be a mass exodus from some of the larger cities into the towns. And our member noted that the first case in another city in the same province had already happened on that day. And so this is just to give you a flavor of the type of information that trickles in Epicor, and it's so extremely valuable for early detection, early verification, of course, and also for risk assessment when we know something's happening and you need to know how things are progressing. So I'll end just by saying that as all of us, as we've heard, Iman said so nicely, it's important for us to move beyond One Health in journals. And as we recognize, our role, it's important for us to facilitate, all of us, our journey from siloed data and siloed approaches to more integrated approaches and insights. And I hope you see that Epicor provided one example of how we can do so. Thank you.